everyone. Thank you for joining us today. We are excited to have you here. This will be an opportunity for us to understand cataracts and the treatment available for the same. My name is Anisha and I'm a part of Dr. Agarwal's team. I'll be your moderator for today. Let's take a moment to introduce our renowned speaker. We are delighted to introduce Dr. Nita Shah, a highly accomplished doctor with an experience of over 3 decades in the field of ophthalmology. Dr. Shah has an extensive expertise and specialization in cataract and refractive surgery. I would really take a moment to thank Dr. Neeta for taking the time to share her knowledge with us. We also will be taking questions throughout the webinar, so please feel free to type them into the chat box. The doctor will be taking questions in the middle of the webinar as well. And now, without further ado, let's start. Over to the doctor.
Thank you very much for the kind introduction. Welcome, everybody. Thank you for spending your Saturday noon with us instead of having a nice lunch at home. So, let's talk about the ins and outs of cataract surgery. So, what we are going to cover up. So, if you have any questions pertaining to this, you can start typing it in your chat box. Is what are cataracts and how do they develop? What are the symptoms, which means how will the patient make out that he has a cataract? What are the treatment options available? And once it is decided that you're going to undergo treatment, what are the pre and post surgery do's and don'ts? And how do we protect our eyes to reduce the risk of cataract? And of course, most important, to get your cataract related questions answered. So today you're going to be talking to Dr. N, Dr. Neeta, and not Dr. G, which is Google. So let's start. What are cataracts? Cataracts are basically a cloudiness of our natural lens, which focuses whatever we see onto the retina, which takes the image to the brain so that we are able to give a name or a title or an object that we see and understand it properly. In case this lens becomes cloudy, which is generally over a period of time and age because of the building up of the natural proteins, it does not allow adequate light to pass through, and therefore the eyesight becomes very blurred. So this is a picture of how a healthy lens looks with the center area black, and this it starts becoming white. And this is how the image is pinpoint and crisp, and this is how the image gets scattered because of the lens being fuzzy, and everything visible becomes fuzzy. So what do we do? How it develops is basically due to natural aging and the proteins, and there are other factors which also provoke it to happen faster or earlier. Habits like smoking and excessive drinking. In patients with systemic diseases like diabetes and high blood pressure, the incidence or the appearance of cataract is much earlier and much more than other people. Too much of exposure to sunlight because of the ultraviolet rays. So these are the general causes, rarely also because of a genetic predisposition in a family to develop cataract earlier, sometimes even in childhood or a very young age. And last but equally important is eye injuries may make you develop cataract much earlier, either immediately after the injury or a gradual build up after the surgery. So what we go on to next is how do we make out that I have cataract? I am the patient, and how will I make out I have cataract? So if things are not seen clearly or not crisp, the margins have become fuzzy, or there are dark shadows in your field of vision, or you are not able to see well in too much of a bright light, or it is hazier at night time, depending on the type of cataract you have. It may be dim in bright light, or it may be dim when the light is less. These are all signs that you need to get an eye checkup done, especially if your age is 50 years plus, because that is the time where the incidence or development of cataract is much commoner.
Doctor,
Faded colors,
we have a
yes.
question from one of the participants.
Yeah.
So Neetu has asked, can cataracts happen at an early age or happens only during the old age?
So you can get a congenital cataract, which is from birth, You can get a developmental cataract, which is in the early teens or even between 5 to 10 years of age. And we also have younger people developing cataracts because of maybe excessive exposure to ultraviolet rays or a genetic predisposition. So, yes, it can happen in a younger age group, but it is commoner in age group 50 plus. Also, frequent changes of eyeglass prescription is an indication, especially if you're 50 plus, to get the eyes checked up. It could be because of cataract, as the vision is fuzzy. When the person is answering, when the spectacle checking is done, the answers may not be accurate and the number may change, or because of the cataract progressing, the number may keep on changing. So this is an image to show what we were talking about just now, like what a normal vision looks like, crisp, clear, and this is how it starts becoming fuzzy, where the vision is there. It's not that you can't see, but the quality of vision is supremely compromised, and this just keeps on increasing to a level where you cannot see. So now we talk about treatment. There is no treatment for cataract with either eye drops or medicines or alternative medicine. The only treatment for a cataract is surgery once it has developed to a level where it is compromising the vision sufficiently to need a surgery to be done. And what is done in the surgery is that the opaque or cloudy lens is removed and artificial lens is put in, which again gives back the clarity and quality of vision that we all deserve to have at whatever age we may be. Generally, the surgical options available are standard phacoemulsification. Phacoemulsification is a machine which emulsifies or breaks up the cataract into tiny pieces so that it gets dissolved. We also have microincision phacoemulsification, where the opening is hardly 2 to 2.2 millimeters, which seal and heal very fast. Zeptocataract surgery is where a zepto machine is used to make the opening in the lens so that we can remove the cataract with the help of zepto technology. And femtolaser assisted cataract, which again uses a femtolaser to make the openings in the eye and the openings in the cataract to help us remove the cataract with the help of phacoemulsification and suck it out when we are doing the surgery. So this is how we perform the surgery. Now
Doctor,
we,
we have
yes.
another question coming up from one of our participants. So, Mr. Shekhar has asked, which out of these treatments is the best one and why?
So microincision phacoemulsification is the best with or without the femtolaser assisted cataract. The femtolaser helps, but in the end you do have to do a phacoemulsification. That would be the best option available if it is fine for your eyes. There are some cataracts and some eyes where we cannot do this and we do a standard phacoemulsification. So I hope that answers Mr. Shekhar's question, Anisha.
Thank you, ma'am.
So then what do we do once we remove the cataract? We put in a lens, like I told you earlier. So what everybody would want to know is which lens should I put? There are so many things which are described, which are told, which is seen on the internet platform. So let me try and make it simple for you. Monofocal lenses. Mono means one. The lens is such where it will give you good vision for distance, but you will need glasses to see near, like your mobile or reading. The second is a trifocal or a multifocal lens, whereby you can see good at the very variable distances like the far, the intermediate, and the near. But in this, because there are multiple rings, the light may spread a bit. So we have EDOF or extended depth of focus lenses where the light does not spread, but in the EDOF lens you get good far and intermediate, that is the mobile hand distance or the computer distance vision. But for seeing very near, you would need assistance with a very tiny number. Last and most important are the toric lenses, which corrects the number which is at an axis. That is called astigmatism or cylindrical power or teda number, where the lens is put in the axis in such a way that it corrects this cylindrical power. They would be available both for monofocal and multifocal lenses, and only when you are evaluated would it be possible to judge which of these lenses your eyes are suitable for. It's a decision taken by you and your doctor together. Very important, pre and post surgery, not to miss out on the drops. Prior to surgery, you can continue with your day to day activities till the day prior to surgery, watching TV, etc. Keep your eyes closed, so even before the surgery you don't want contaminants going into your eyes when you take a shower. You rest and relax and wear protective eyewear or glasses when you want to go out. At the time of the surgery, see that you're not having any eye makeup on, it's cleaned off very well. Contact lenses are discontinued for a few days prior to the surgery, and also you do not consume excess of alcohol.
Doctor, we have another question from one of our participants.
Sure.
Mr. Abhay asked that I have undergone cataract surgery around 10th of July. I'm finding black circles moving around left eye continuously. I had consulted with the doctor recently. I was told that it will get cleared after some time. Please advise since it's getting frequent disturbance due to the circles.
So generally, if you are talking about floaters become more visible after the cataract surgery because the cataract has blocked off your visibility and made your vision fuzzy. If what the doctor's saying they are floaters, they would generally settle down over a period of time. If they don't, your retinal evaluation needs to be done to check that there is no other problem which is causing you to have these black circles.
Thank
So
you,
now
doctor.
we so now we go on to the post-surgery do's and don'ts, which is you can start shaving by the third day. You can comb your hair from day one. Watching TV and all is allowed within a day or two. You need to wash your hands with soap and water before you apply any eye medications, and do wear a protective eye cap, and see that you clean your eyes properly with sterile wipes. If you don't have the wipes, you use clean boiled water and soak cotton in it and clean the area around the eye. Very important that you need to contact your eye surgeon immediately if there is a problem. We do not want you to rub your eyes with your hands or fingers. First week, not to take a shower bath. You can take a bath neck downwards. Normal water should not be splashed on the eyes at least for the first week to 10 days. And do not partake of any activities by which you can injure your eye accidentally in the first week or so. Do not lift heavy weights, as these may increase the pressure in the eye. So, how do we prevent or delay or avoid getting a cataract? Regular eye checkups is important so that you know what is happening in your eye other than cataract, like things like iridocyclitis, glaucoma, which can increase the frequency of developing the cataract. General health should be taken care of with a very good diet, which includes plenty of fruits and vegetables. We need to use sunglasses when we are outdoors, especially in a country like India where we have so much of sunlight and UV light everywhere. Partake of alcohol consumption within limits, not to overdo smoking. Smoking should be stopped. Alcohol should be within limits. So, if you have diseases like diabetes or BP, it is very, very important that your diabetes is kept under control, because that is one problem where it is known that cataracts develop much earlier. Also, if by chance you have a disease where you're taking cortisones, try and get it controlled so that your cortisone use is reduced. And again, the predisposition to developing early cataract is avoided by doing that. So, this is a very brief overview about the general awareness related to cataract, types of cataract, cause of cataract, also how we treat and we do not treat. Um, I'm sure you can ask us questions and we can address those now. Over to
Doctor,
you,
we have a
Anushka.
question coming up from Mr. Neil. He asked, my mother recently got her cataract lens implanted. We went with synergy lenses for both the eyes. It's been 3 months since the surgery, but my mother is still facing persistent pain, unable to open the eyes in daylight, and a pricking sensation and dryness being formed around any artificial light. We sought the opinion of the doctor, and he prescribed some steroid and allergic drops, but still the problem is persistent. Please suggest what to do.
Thank you for your question, Neil. This is something which we do encounter with the best of lenses. You've gone ahead with very good trifocal lenses, and very often this is seen in women who are postmenopausal because basically, because of hormonal changes, their eyes are dry. And the moment we do a surgery, the dryness increases. I would suggest you visit your doctor for getting adequate lubricating eye drops to be put along with the steroids that you're putting. There are drops which are in the form of polyvinyl alcohol or hyaluronate or even methyl cellulose. They would definitely be able to tell you which suits her. And we also have tests for dryness, which is called as IDRA or similar tests, where we can check what level of dryness she has and address it and definitely make her more comfortable than what she is now. I'm sure it will be solved once you treat the dryness of her eyes.
Thank you, doctor. Another question coming up from Mr. Manish. He has asked, can cataracts come back after surgery?
So, Manish, no, cataract does not come back. What does happen is that the layer of the lens on which we have fit the artificial lens can become a little hazy or cloudy over a period of time. That's not cataract. It is called capsule opacification, and we can treat it by a simple laser, a 1 minute job, and just dissolve it in the center so that the vision becomes clear, and very important, it does not come back again. So then your question would be, why was it not done at the time of surgery? So this is the layer which holds my lens. So I don't want to fiddle with it when I'm operating. Later on, after 2 to 3 months of surgery or whenever this type of haziness comes up, we just dissolve the center so that the lens does not move and the clarity of vision is restored. So, to conclude, the cataract does not come back.
Thank you, doctor. Another question from Ms. Sumona. She asked whether cataract surgery is painful. Will one feel pain during or after the surgery, and whether painkillers are given for the same?
More than 90% of the surgeries, there is zero pain. And in the others, there may be very occasional mild pain on the day of surgery, which goes away with normal painkillers like paracetamol. Post surgery, there may be a little discomfort for 24 hours or so, but generally, no pain with modern cataract surgery.
Thank you, doctor. Next question is from Kritika. She has asked how many days it takes to recover from cataract surgery.
So we will divide this into two types of recovery. One is the recovery of the eyesight. Now, depending upon how old or hard the cataract was or mature the cataract was, it may take a day or 2 to 3 days to get back the vision. And then when we talk about overall recovery of the eye, it is that we don't allow you to go out or take a head shower or start going near the gas for a week or so because we don't want you to be exposed to any form of infection which may come in because the areas or the wounds through which we have entered the eye, even if they are 1 millimeter or 2.2 millimeter, we want a week for that to heal, and then you can get back to your normal activities like your exercise, your walk, taking a shower, going near the gas. The only thing which I don't allow for a month is swimming and eye makeup, the use of eye makeup. The rest, everything you can do in a week, and seeing or getting back your eyesight is generally between 24 to 72 hours.
Thank you, doctor, for that. We have the next question coming up from Mr. Ashok. How long does the lens typically last post surgery?
So, Mr. Ashok, we put these lenses in babies and children who are going to live 70, 80 years. We have not seen a problem, especially if you use lenses from the established companies and good quality lenses. The lens does not have a life that it has to be changed, or like a spectacle lens gets scratched or damaged. No, they are with you your whole life.
Thank you, doctor, for that. The next question is from Geeta. She's asking whether does menopause increase cataract risk and will it subside after few days?
Cataract does not subside. Cataract has to be operated. If it is very early and the vision is good, you may wait and do the surgery a bit later, but it does not go away on its own. Menopause is not a risk for cataract at all, but it does increase dryness of eyes because of the hormonal changes. But the age group in which menopause is occurring is an age when cataract starts in quite a few people. It's a coincidence that it happens at that age because of the age.
Thank you, doctor, for that. Another question from Mr. Manjunath. He has asked, do I need specs after the surgery?
Again, it depends on what lens is being put. As we discussed earlier, if it's a monofocal lens, that means mono means one, you will need glasses for near activities. If you are having a cylindrical power and you have not put a toric lens, you would need the cylindrical power to be put in your spectacles. But yes, we also have trifocal lenses and EDOF lenses, which takes away your dependence on glasses. But in trifocal lenses, 1% of the patients who are operated may need a very thin glass occasionally. This figure becomes 13% in the extended depth of focus lenses, where 13% of the people may need a thin number, small number to be used occasionally. So, to go back to your question, you would need glasses depending upon the lens that you have selected for your eyes, whether it is a monofocal or whether it is a toric or whether it is a trifocal or EDOF lens.
Thank you, doctor, for that. We have another question from Mr. Santosh, who has asked that I had operated for cataract, little water flowing in that eye. What to do about that?
One, we need to check up how long back you were operated, whether it is happened only after the surgery or it was persisting before the surgery. Your tear ducts need to be syringed to check whether there is any blockage which has caused the watering. That has nothing to do with the cataract surgery. And very often, if only one eye is operated, the patient may be watering all the time, strained, and may water. So these are the very obvious causes by which they may be watering in your eye. These are the various causes by which they may be watering in your eye. So if you are having a cataract in the other eye, please do not assume that it is the only cause because of which you are getting the watering. If you are having a cataract in the other eye, please do it fast. God has given us two eyes. Let's not put the burden on only one eye. I hope this answers you, Anisha.
Yes, thank you, doctor. Mr. Arif has asked how much should be the sugar levels to go ahead with the cataract surgery? Also, does cough affect cataract surgery?
Sorry, the second part again.
Also, whether cough affects cataract surgery, cold
So
and cough.
the first part is at our center, we would not like to do cataract surgery if the sugar reports, especially the post lunch, are 200 and above. We want it below that when we take up the patient for surgery. The reason being that after surgery, the food intake, the activity, everything gets changed and restricted. A person who may be going out for walk or work, etc., is now indoors for a few days. So this would make the sugar jump up. So we want to go with normal or close to normal levels, which is below 200, so that even if it increases a bit for a short time post surgery, we are not in the danger zone, which can lead to complications after cataract surgery. And Anisha, what was the second part of the question?
Whether cough affects cataract surgery.
So, no, it does not unless it is very, very bad. At the time of surgery, you just need to tell the doctor when you feel you're going to cough. So, they will pause, tell you, yes, you can do it, and proceed. Generally, the patient's worry is what happens to the lens if I cough after the surgery is done in a few days. Nothing will happen if you have gone for phacoemulsification surgery, where the opening in your eye is very tiny. For microincision, it is just the size of a pen tip and seals very fast. So don't worry about the cough, but please do discuss it with your surgeon about your cough so that you and he can together take a decision about whether to defer or wait or whether you can proceed with the surgery.
Thank you, doctor, for answering that. We have a question from Nisha. She has asked what kind of anesthesia is given during the surgery? Is it local one or something specialized?
So, most of modern cataract surgery, we do not give local anesthesia. We give what is called as topical, means numbing eye drops, जो आँख को सुन कर देते हैं, are put in the eye. But yes, there are special situations like the cataract is so hard or mature that the patient can't focus, so they keep on moving their eyes, or the patient can't understand the surgeon's language, or the patient is having deafness. These are the patients where we would use a local anesthesia. Also, complicated cataract surgeries like following injuries or overripe cataracts, where we know we are going to have to handle a slightly difficult case, we would want to give local anesthesia so that the patient is comfortable even in spite of a slightly more prolonged surgery. But generally, it is only with the help of numbing eye drops or topical anesthesia.
Thank you, doctor. I hope, Nisha, that answers your question. Mr. Ashish has asked, does laser procedure help in recovery compared to other standard procedures?
Yes, it does help because the laser accuracy, efficiency in making the openings is definitely superior to it being done otherwise. But it is not mandatory. You would get a good result with both, with and without the laser. Because even with the laser, the phacoemulsification has to be done in that surgery.
All right, doctor. Next question is coming up from Mr. Manjunath. He has asked that I am on statins and blood thinners since 15 years. What precautions should I take before the surgery?
There is no precaution needed for a patient who is on statins. But if they are on statins because of any heart problem, we would need a cardiologist or an MD physician to examine the patient, check their cardiogram, etc., and tell us whether he is fit to undergo the surgery. Remember, Anisha, even though we are operating on the eye, the whole individual is entering the operation theater. And surgery for you or me or anybody is a stress. We don't want them to have any problem other than what we are able to handle. Remember, I'm an eye surgeon. I don't know about anything else but the eye. So I want this problem to be handled prior to surgery by the required cardiologist or MD medicine physician in case the statins have been given for any heart problem. If it is just given for any slight raised cholesterol, we don't have to worry at all and we don't need to change any medications. We can go ahead with the surgery.
All right, doctor. Next question is from Mr. Arif. He has asked, post cataract surgery in one eye, can we use contact lens in the other eye instead of specs?
In the other eye, yes, no problem at all. In the cataractous eye, if they have to use it, they should do it after 2 to 3 months.
Okay, doctor. Next question coming up from Mr. Ashish. He has asked, should the anticoagulant be stopped for 2 to 3 days before the surgery?
What should be stopped?
Anticoagulant.
So, This is something which is a bit of a dicey situation. It depends upon why you have been given the anticoagulants and how important they are for you. And the physician is the person to decide whether it is to be stopped. If it is a routine cataract surgery, which we are going to do with eye drops, and we don't expect to give an injection for a block, etc., we would not want to stop the anticoagulations from our side. But if the physician decides to do it, it's fine. Generally, starting or stopping the anticoagulants is never done by us, it's done by the physician, and we generally leave the decision to them. By chance it's a combined surgery like a retinal surgery along with a cataract surgery, then yes, we would request the physician to stop or reduce it, because then the chances of bleeding in the eye at the time of retinal surgery becomes more. But a simple straightforward routine cataract surgery under topical anesthesia, we would not want it to be stopped, but we would just leave it to the physician to decide.
Thank you, doctor, for answering that. Hems has asked what tests needs to be done prior to the cataract surgery.
So we have a battery of routine tests which are done prior to all surgeries, which is the blood pressure, complete blood count, fasting and post-lunch sugars, a triple H report, which is for hepatitis B, C, and HIV, a serum creatinine to check the kidney function, a urine routine test is done, and we would do an HbA1c in case the patient is a diabetic to know the control of the previous few months. These are the basic tests done along with the cardiogram. Other tests would be depending upon the results of these tests. If there is anything off in these reports, we would maybe ask for more tests to be done.
Okay, thank you, doctor, for that. Uh, Someone has put up this question that I had retina detachment surgery in June, and now doctor has mentioned that I have developed cataract. How long should I wait for the cataract surgery, and is there any risk to do the surgery?
So the retinal surgery was done in June.
Yes.
So generally, this decision is taken by the retinal surgeon depending upon the status of the retina post the detachment surgery. If the cataract is not too bad, a wait of 3 months is what would be recommended. But again, it is the retinal surgeon who would say whether he would want us to wait for a longer time.
Thank you, doctor, for that. Uh, Team, we are running short of time. Really sorry for that. But any further queries you have regarding cataract or any other queries, please write to us in the email mentioned, or you can even call us to the number that has been mentioned. Having said that, I would really take a moment to thank Dr. Neeta for the information that she has given around cataracts. And I really hope that the participants will benefit from this session. Uh, that's all we have for you today. Thank you for joining us and giving us the time. We appreciate you signing in and hope all of your queries have been answered. If not, do write to us. We will see you in next time. Thank you so much, guys.
Thank you, everyone. Thank you for joining in. Hope I could do justice to whatever you wanted to know. Have a good day and a good weekend.
Thank you.